Leptin is kind of a new thing on the wave. We don't know a lot about it, but what we do know about it has been extremely helpful for most of our patients, especially where weight loss or diabetes or high cholesterol, where those things come into play. They can be a huge factor in things. So that being said, we're going to get started. So this is what the molecule of leptin looks like. It's also known as the obesity hormone or the fat hormone. It is actually a hormone. There is some question as to whether or not it's a protein hormone or a fat hormone. Some people refer to it as either, so you'll see it referred to as both. We just kind of call it a hormone. It is a hormone that typically a lot of people don't look at. It may be partially because we don't know a lot about it yet, and a lot of people don't know what to do about it if it is elevated. So that becomes a problem. In conventional medicine, if we measure something but we don't know what to do about it, we kind of figure, let's not measure it. In the alternative world, we have that same philosophy in some respects, but we have a lot of herbs and we have nutrition and we have all kinds of things that we can do something about it, even though there may not be an actual medication that can do something about a high leptin or a low leptin level. So the other thing that you want to know about leptin, and we'll talk about this a couple of times, but it's the starvation hormone. So people who are in starvation mode will oftentimes have higher leptin levels, but it's also known as a satiated hormone. So when leptin is off, you're not going to feel satiated when you eat. You're just going to kind of eat and eat and eat and not feel comforted or not feel full. So that becomes an issue with obviously weight gain and some cholesterol issues and things like that. Leptin is made by the fat cells themselves, so the more body fat we have, usually the more leptin we have. Now that's not always true because there are thin people who have high leptin levels, but most of the time we'll look at that and say, well, that person's thin, there's no way they can have a high leptin level. But if you're thin, but your composition of body fat is high, you could still have a high leptin level. So just because you're thin doesn't mean you don't have a lot of body fat, okay? So this is how leptin works. Besides being made in the fat cells, leptin also adjusts and stores in the fat cells as well. So you can have too much leptin because you have too much fat. You can have too much leptin because it's a stored hormone. For anybody who knows about hormones, oftentimes hormones like to store in the body fat tissue. Estrogen does that, progesterone does that, occasionally testosterone, but usually estrogen and progesterone are the two main ones that do that. When it stores in the body fat, that's what adjusts our hunger. So sometimes when people say, I'm always hungry no matter what, that would be a cue that maybe their leptin level is high, and that's why they're always feeling hungry, okay? These are two little mice. I thought they were cute, but it is truly a leptin mouse and a non-leptin mouse. So you can see that in the animal that's very large or fat, he has more leptin, or she has more leptin secreting from their hypothalamus. So all of our hormones come from the pituitary and the hypothalamus. Leptin is not really any different than that. That's where it stems from initially anyway. All right. There we go. So do most people know we have two different types of fat, white fat and brown fat? Okay, we do have two different types of fat, white fat and brown fat. Leptin primarily likes the white or the brown fat, so it doesn't matter what type of fat you have, and there's really not a good way for us to determine it. We can't look at you and say, oh, you're tons of white fat there and you've got a lot of brown fat, and we don't know that. You know, some people will claim they can figure it out, but it's really hard to figure out what kind of fat you have. But it primarily likes to store there. It can also be produced in the ovaries, the skeletal muscles, the stomach, the mammary glands, epithelial cells, bone marrow, pituitary, liver, and our gastric cells. So there's lots of different places that leptin can store, not just in the body fat, but it affects all of those because it's a hormone. So it works like all the other hormones do, and it can be stimulated by all the other hormones. And I would suspect at some point we're going to find out that it is affected by other hormone receptors in the body, just like estrogen and progesterone are. We probably won't know that for years yet until people start studying it more. But my guess is, since it's a hormone, it's going to act like all the other hormones do as well. So you could end up getting a level of leptin that starts to fill the hormone receptors in the body, since all these areas use it. and then they can flood those receptors and it may act like it's not there at all. We know about leptin resistance, and we'll talk about that a little bit, which is a little bit different, but kind of similar to that concept that the receptors get flooded and it can't respond anymore. Okay, so leptin circulates in the blood as a free form. So when we talk about measuring hormones, the ideal way to measure any hormone is in the free form. In blood, it's very hard to measure free forms of hormones. You usually measure bound hormones. They're bound to proteins. But leptin is opposite of that. That one we can measure by blood. It is a free hormone, so nothing is bound. So the lab that we're going to see in a blood test is going to be a pretty accurate lab. Where with other hormones, we'll say, you know, we'd prefer saliva over blood because it's in its free form that way. You're going to see leptin levels vary with fat mass. Like I had said earlier, thin people typically have lower levels of leptin, but not always. Leptin is also highest in the body between midnight and early morning. So you want to make sure you're aware of that when you're testing. If you test somebody in the late afternoon, you may not be getting their normal peak. So you just have to take that into consideration when you're drawing the test or when somebody's having it done, that if it's a borderline level, maybe it's really higher in the morning time and you should do it at that time. Yes?
Does it matter, like I'm a second shift worker?
Doesn't matter.
It's still, I'm awake from midnight to 5.
Still wouldn't matter.
Still would be, it doesn't matter with sleep.
Correct, doesn't matter with sleep. Okay, when the body goes into starvation mode, and we will go into starvation mode when you go long periods of time without eating. So ideally, we should be eating about every 2 to 3 hours, something. Handful of nuts, handful of seeds, little fruit, little vegetable, little protein, and you always want to mix a carbohydrate with a protein because you want your short-term fuel and your long-term fuel for a snack. If you're having a meal, you want carbohydrate, protein, and a fat serving with that meal because that's a complete meal. Okay? Then you get your immediate fuel source and then you get your long-term fuel source. Okay? When we go into starvation mode, so say somebody doesn't eat for 5 or 6 hours, their body's starting to go into starvation mode. What typically we would like to see happen is that it should eat our body fat. And it doesn't do that when you go into starvation mode though. It eats your muscle mass, not your fat. So that starvation mode, or that idea that I'm proud, I can go all day and not eat and I feel great, not really the best thing for us to be doing. We shouldn't be doing that. We need sugar in our brain to function, but we also want our body fat to be eaten away the way it should be, okay? When you go into starvation mode, you shut down something that we call the vagus nerve. And when that vagus nerve shuts down, you tend to get hungrier. Now, most people will say, well, the longer I go without eating, the less hungry I am. And the more you do that, typically, the more you kind of just tell your body, I'm not hungry, and you can go longer and longer periods of that. That's the body's mechanism for protection. But when you do that continuously, day after day after day, it does create a lot of cellular problems for us. It also affects the adrenal glands, and it affects your whole hormonal system. And it typically will actually prevent you from losing weight, not allow you to lose more weight. Your body will hold on to everything it has because it's not sure when you're going to feed it. And if it's not sure when it's going to feed it, it's going to store it as, guess what? Body fat, because that's what it can utilize the most of. So not the best way for us to be thinking about things. Leptin is actually designed to take up and be utilized for energy. That's part of the reason it's stored in the body fat. But the higher it gets, the less energy we actually use. Yes?
You said it shuts down the vagus nerve, and where that it says turns on.
Oh, I'm sorry, I misspoke.
Oh,
Yeah, it is turning it on. Yeah, sorry. Okay, so I'm just looking at this to see if I already said this. Kind of. This last thing is very similar to what I was just talking about. If we eat more frequently, our leptin levels become more stable instead of spiking and falling and spiking and falling and spiking and falling, like our blood sugars do. We don't want that to happen. We want some continuous levels of things, okay? Okay, so leptin decreases after short hours of fasting. So 24 to 72 hours, that's considered short fasting. Leptin levels will actually decrease after that. So that's why diet can make a huge difference on leptin levels, and we'll talk a little bit more about how we can implement that. We do know that people who have sleep apnea, specifically obese people with sleep apnea, will have leptin levels that are increased. We're starting to find that sleep issues create a lot of problems in the body, a lot of medical conditions that we weren't aware of before. So this can be a big issue. Leptin, high leptin is also perceived in people who have higher emotional stress. So if you're under a lot of stress, you're always running, you're always chasing, we're going to see higher leptin levels there. We will see leptin decreased with testosterone or estrogen use. So one thing that we know is the lower the estrogen or testosterone gets, testosterone for men, estrogen for women as we age, the higher our leptin levels become. So when people say, I was fine with my weight until I entered menopause, and then all of a sudden I gained all this weight, most likely it was because their leptin levels started to rise when their estrogen levels started to fall. And same thing with men. And we've kind of said this for years, that it's the fall of the estrogen that causes the weight gain, or the fall of the testosterone that causes the weight gain. And there probably is still some component to that. But now that we know leptin rises with those issues, that's probably the bigger reason why we see the weight gain occur in that factor. We know that leptin will go down with increased physical activity, which makes sense, right? We increase our physical activity, we create more muscle mass, we get rid of more body fat, down goes the leptin because you don't have as much body fat there. We also know that people who have higher insulin levels, so that pre-diabetic state where we say they're in that hyperinsulinemia state, they're going to also have higher leptin levels. So it's very common for us to see high insulin levels and high leptin levels together. Sometimes in a very early state, we may just see the leptin level up a little bit and it hasn't yet affected the insulin level. It's rare, depending on how high the leptin level is. If the leptin level is only a couple of points above normal, you may not see that insulin level affected yet. But if it's double what it's supposed to be, almost always the insulin level is affected as well. So these are some of the conditions that we see people who have high leptin levels. They'll have cardiovascular disease, they'll have diabetes, a lot of inflammatory conditions, so the inflammatory arthritis. I haven't correlated it quite yet to some of our autoimmune patients, but the aging process itself causes an inflammatory response. So we will see the leptin level high in people who just have a chronic inflammatory condition going on in their body. People who have hypertension will have usually high leptin levels. The metabolic syndrome, that's the same thing as hyperinsulinemia, so that's where we see that high level. Interestingly enough, we see high leptin levels correlate to people with colorectal cancer, and we're now seeing people who have high leptin levels have a higher incidence of breast cancer as well. We're just starting to see some data to do that. So this is actually a study where they looked at leptin and its receptor and how it was expressed in a group of women who had breast cancer. And they actually correlated it to a increased growth or a promotion of the cells of the breast tissue that were malignant to begin with. They also saw some issues with insulin and some genetic factors too. So they're still kind of trying to figure out how does this all fit together, but there definitely is a link. There's probably, I think I found 3 or 4 different studies correlating high leptin levels with breast cancer when I was putting this together. Okay, so earlier we talked about that insulin resistance and leptin resistance. So as leptin gets higher, just like with when when insulin gets higher, your body can become resistant to that. So think about every time you eat something with sugar, your body produces that insulin, and you've got to get that sugar down. Well, the same thing happens with leptin. When we eat a high carbohydrate meal or we have lots of sugar in the diet, all of a sudden that leptin starts getting higher and higher and higher, and it can't go up and down like it's supposed to. So that starts to create a resistance. And that actually happens in the communication of the brain. So where the hypothalamus and the pituitary are trying to communicate with the rest of the body to produce leptin at a particular level, that kind of gets desensitized. And it stops the signaling in the brain that makes you feel like you should stop eating. So people just keep eating and eating and eating and eating, and that leptin level gets higher and higher and higher. So this phenomenon is what we call leptin resistance. You can come on over. We don't mind. We talked a little bit about how it correlates to insulin resistance. It can also correlate to type 2 diabetes as well. So all those people that have that quote-unquote pre-diabetic state, where maybe their blood sugars are just a little bit higher. Most conventional doctors don't look at insulin levels, they just look at blood sugars. So we're really missing a big group of people who kind of fall into this sector. And most conventional practitioners will say if your blood sugar fasting is less than 99, you're okay. But alternative medicine really says you need to be having that blood sugar fasting less than 90 for an ideal situation. So we're missing a large group of people in that conventional realm that are in that pre-diabetic or pre-insulin state that could be managed with diet and exercise and some supplements and potentially never reach the point that they need to be medicated with insulin or any of the other medications like metformin and things like that. Okay, we talked about the decline of decline of estrogen. So how many people know someone who has had a total hysterectomy and was completely fine until they had the hysterectomy and then they gained all this weight? We pretty much all can identify somebody like that. Well, we know that when the ovaries are removed, women tend to gain more weight. It's pretty common, even in animals. Animals that are neutered or spaded, they get fat after a while because we've taken their whole hormonal system away, all the main parts where they make all their hormones. Well, women are really no different. And part of that issue is because of the connection between leptin and the ovaries. So in women who have been in that position, they really should be having a leptin level check to see where they're at, because that is most likely, and the decline of the estrogen are the two main reasons why they're having that weight gain immediately after hysterectomy. We know that women who use estrogen supplementation will have a 70% reduction in their leptin levels, usually over about a 3 to 6 month period of time. So that's pretty significant. It's a pretty empowering thought that, you know, we have all these negative things that estrogen does, but there are a lot of really positive things that estrogen can do for women. And this is just another one of them that's really important for us. Leptin and cortisol. Cortisol also is kind of the in the world. Cortisol can be a good hormone or it can be a bad hormone. If there's too much cortisol, that's a bad thing. If there's not enough cortisol, that's a bad thing. It's one of those hormones that you've got to have a lot of balance with. So we know that people with elevated cortisol levels you can have a lot of problems with weight loss if you have a lot of cortisol. It's much like Cushing's disease. So if you look up Cushing's and you look up Addison's, most people who have an adrenal problem are going to fit somewhere in the middle. And they're going to say, well, I have symptoms of both. Well, that's because they don't have a disease state. They have a functional issue going on, and you'll vacillate between both of the symptoms. But if you have cortisol that's elevated at night or elevated in the morning time, you're going to significantly have a problem losing weight. And this is an important factor to know. We think that what is actually happening in those cortisol people when they're losing weight is that there's actually a leptin resistance going on. So anyone who has an elevated cortisol level should be having a leptin level checked also. Let's see. Do we talk about this? Yeah, we pretty much talked about that. Oh, what I will say on this point is when people have a higher leptin level, they'll typically be more inclined to eat late at night, between like 6 and 10. That's when it seems to turn on and they're eating and eating and eating and they can't stop. They might not want to eat all day long, but then all of a sudden it comes after dinner time and they can't stop eating. And then they're not feeling satiated and then they keep eating and then they go to bed and then they don't feel good because then they get GERD. And so a lot of that stems from that higher leptin level. And if the leptin level goes down, you don't have those nighttime cravings anymore. Now, if the cortisol levels at night are high, you're going to feel hungry, you're not going to sleep. And if you're not going to sleep, you're going to do what? You're going to get up and eat, and watch TV and try to go to sleep. So it's a vicious cycle, and it comes from both the adrenal glands then and from the leptin being elevated. Yes?
Does it have effect just on the high cortisol, or what if your cortisol never rises?
If it's tanked, you have very little or no adrenal function. And they don't correlate leptin specifically with that, but I would say since the hormones that come from the adrenals are hormones, they're going to have some effect on leptin. We probably just don't have the research yet to know exactly how that effect is. But even people that have a really low cortisol level, they have a difficult time losing weight also. So I would suspect that we're going to see a very similar process with this. Yeah.
What's the difference between leptin and ghrelin? Because this whole description sounds like ghrelin to me.
They're very similar.
I thought they were the opposite.
They're opposite, but they're similar. So they're both hormones. And when you look at ghrelin and you look at leptin, and this is kind of the same with most hormones, is that you can find symptoms on both sides. The problem is we don't have a really good test for ghrelin yet. There's no conventional test that's available, and we really aren't sure what to do with it, if it's elevated or if it's low at this point. We don't have medications, and there's not much in the way of supplements to specifically target that, but pretty much all the supplements you would use for a leptin resistance, you could probably use for ghrelin issues as well. And they should probably change them because they're so interconnected. Oh, I'm sorry. I didn't turn this off. It's my son's ringtone. You gotta love the Duck Dynasty thing. Okay, leptin and cytokines. So cytokines are somewhat, they're inflammatory markers that we use. Sometimes they're used specifically for immune function or looking at autoimmune issues. In my opinion, there's not a lot of great places to get good cytokine panels done. When you look at a cytokine panel, you want about 8 different cytokines drawn, and the only lab that I know that does all of them that we would be looking at would be Dynacare or LabCorp, so that's who we typically have started using for cytokines. The important thing with cytokines is they tell us, A, how much inflammation is going on, and more importantly, it tells us what side of the immune system are you stimulated on. So are you stimulated on a Th1 side, or are you stimulated on a Th2 side, or are you deficient on either side? And it's important to know when there's an autoimmune issue going on, because there are certain herbs we would not want to give somebody who's stimulated on their Th2 system versus if they were stimulated or deficient on a Th1. Years ago, before we understood what cytokines did and that we had that ability to find out which herbs you would use, if somebody had an autoimmune issue in our world, in the alternative world, we would just give stimulating herbs that boosted the immune system. Echinacea, astragalus, green tea, colostrum, a whole number of things. The problem is we'd give that kind of blindly. If we didn't know what their cytokine situation was and which side their Th system was dominant or deficient on, we could make them worse instead of making them better. And you wouldn't necessarily know if they were worse for about 3-4 months afterwards. So using cytokines, it helps us identify which side of that system is elevated and what do we have to do about it, and which herbs can we more specifically give to make the system better. So not only does it create that system, leptin, because it's also considered inflammatory, it's sometimes important to know which cytokines are being secreted by what fat cells. So this is kind of a more extensive test. I wouldn't recommend doing a cytokine panel on everybody that was elevated with leptin, but definitely people who have a high inflammatory response or have an autoimmune disease, or I should say condition, not necessarily disease, but or somebody who has a really, really high leptin level, like somebody in the 60s of a leptin level, then you would probably want to consider a cytokine panel. Especially want to do a cytokine panel if somebody has high cholesterol or their C-reactive protein is elevated or fibrinogen, things that are going to increase their risk for cardiovascular disease. That would be an important time to look at a cytokine panel then. So we know the more fat we have, the more inflamed we are, the more leptin we have. It's just that whole vicious cycle you keep hearing over and over and over again. So what foods increase leptin? Well, since leptin's like insulin, that's pretty no-brainer. Anything that converts to sugar quickly or is a high carb is going to increase leptin level. So any of your processed white sugars, any of your processed high carbohydrate meals, Fruits that contain sugar and convert to sugar more rapidly could also increase leptin levels. So that would be things like bananas and melons, things that are low on the glycemic list, like your berries or your citrus fruits or your green apples. Those would not do that. So you'd want to look at anything that has a high glycemic index, and those are the foods that are going to raise the leptin level for you. Pretty much, I would say, breads and grains that don't have a lot of fiber to them are going to also create problems with high leptin levels. So if we're looking at which macronutrients tend to do that, here's a good picture of it. All of the good stuff is pretty much a no-no when leptin is high. Cookies, candies, sugars, all that wonderful stuff that we love that tastes so good, but then we feel guilty about eating afterwards, or even better, we feel worse when we eat them. We hope we feel worse when we eat them because then you won't eat them so much. But some people feel really good when they eat them and then they want them more. So these are the kinds of things that are going to cause chronically elevated leptins. So I have some patients that say, I never eat cookies and candies or cake or any of that kind of stuff. My diet is clean. But guess what they do the most of that creates a problem with leptin? Soda. Soda or sweetened teas, those are big problems for leptin. If you're doing unsweetened teas, that's fine, but soda is going to be a big problem. Even your diet soda. And please don't drink diet soda. It's rat poisoning. Okay? You don't want to do that. If you're going to drink soda, you're hearing it from me, drink a regular soda. Just don't do it that often. Go out and have your diet or your regular Coke and rum or 7-Up and whiskey, whatever. Have it at a special occasion, but just don't drink it every day all the time. Yes?
What about a tea that's sweetened with Truvia or stevia?
Well, Truvia is stevia with regular sugar. So you wouldn't want to do Truvia, but you could do stevia or agave or honey or molasses. You could have something sweetened like that. That would be okay. Mm-hmm. Okay.
You
Yes.
use the word some dairy. I ingest milk kefir.
Okay.
There's no sugar in it.
Okay.
And I just wondered, is that a bad dairy or a good dairy?
If it's milk kefir that doesn't have any sugar in it, you're fine. But milk itself has a lot of sugar in it. So I'd be questioning how are they making it that they're not getting actual sugar in it from the milk raw ingredients.
I think it's because you put these little grains in the milk and it turns into milk kefir.
Okay.
But you start with milk.
So then
It
you
has
still have sugar in the milk.
The milk has its own sugar.
It has its own sugar.
That's why
So
I'm asking.
if you were doing a lot of it, I would say it could be a problem because milk sugar can really raise the sugar levels quite a bit if you're doing a lot of it. If you're doing a 6 or an 8 ounce glass of it a day, it's not going to be much of a problem, especially if you're doing it with a protein source of some kind, like you're using it to mix into a whey protein or a soybean protein or something like that. You'd be fine because you'd be slowing that metabolism down a bit. Yeah, I'll come right to you next.
Are those nuts on the
I was
bottom
just
next to
gonna
the
say,
ice cream?
Nuts.
Those are nuts.
Green.
Those are bad.
Nuts are very high in fat, believe it or not. They're not classified as a protein source. They're classified as a fat source. So if you're doing a lot of nuts as your snack, you've got to be careful if you've got a high leptin level because they are a fat source, not necessarily a protein source. Some nuts are better than others. So like almonds would be better. Peanuts, they're just fat. They have some protein, but they're really more fat. So almonds, raw almonds, or cashews they're high in fat too. Pistachios is definitely a fat. So, yes?
I love Skinny Pop popcorn. What about that?
Skinny Pop popcorn.
100 calories.
Carbs and
It's got a lot of carbs in it. I'd say it's processed if it's called Skinny Pop, unless it's just popcorn. I'd look at what is in there as a preservative, because my question would be, it's very hard to find a corn source that's not genetically modified these days. So if it's a GMO popcorn, I'd say absolutely not, because that destroys the nervous system. If it's a non-GMO popcorn, then you could go ahead and do it. It'd still be a high carb content for you, but if you did it with a protein source, you'd be okay as long as it was a smaller version. Like you wouldn't want to do a whole bag of it, like you could do at the, theater. That's always a good one. Did I answer your question?
the nuts.
It was the nuts. Okay. Okay. So if we want to lower leptin, we do what everybody should do, kind of that Mediterranean diet, or some people are now turned on to the paleo diet. Things that grow on the land and live on the land, as long as they're not genetically modified, are safe to eat. Fruits, vegetables, lean proteins, minimal carbohydrates, but if you're not going to do a lot of grain carbohydrates, you need to increase your fiber source with your fruits and vegetables. It's very hard to get enough fiber in. You need about 50 to 100 grams of fiber a day minimum. So if you can't do that in the source of vegetables and fruits, then you definitely want to do an additional fiber source. You know, like flaxseed would be a great fiber source. You can do ground flax meal, throw it in a smoothie, or sprinkle it on yogurt, or sprinkle it on like some homemade granola or something like that to increase your fiber source. You want to make sure that you're not overeating at any meal. So you want to make your meals small, frequent, and not large. So occasionally when we go out, you know, you have your 10-ounce filet somewhere and a nice big baked potato. That would really be considered overeating at a meal. You want to do small portions of protein at a time, 3-ounce servings of protein with a nice fruit or vegetable or salad. And you can kind of, you know, if you look at your plate, it's kind of like what everybody is promoting these days. The majority of the plate has vegetables on it, smaller fruit, smaller protein, that kind of thing is what you're looking for. And you want to do that frequently throughout the day. So how can I give you a good example? So we do some diets based on a genetic type called the APOE. So if you're, I'll give you for instance, if you're a 3-3, you're a neutral type. So you can have pretty much foods from every category. If you're a 3-4, you're doomed. You can hardly have any fat. You get like 3 servings of fat a day. And a serving is like 2 tablespoons of peanut butter. So there's not much fat in that diet. It's hard. But you would do like, on a 1,200 calorie diet, you'd do like 5 servings of your grain carbohydrates. You'd do about 8 servings of fruits and vegetables. You'd do 6 servings of protein a day. And you get about 5 servings of fat a day as a neutral. And you would divide that up throughout the day, remembering to do a fat source with a protein for a snack, or a protein or fat with a carbohydrate. I think I said that backwards. And then for a meal, you'd do a fat, a protein, and a carbohydrate together. Okay? So you'd have a complete meal, and then your snacks would be short-term, long-term fuel like we talked about earlier. That's going to help you lower that leptin level, and amazingly enough, it's going to really lower your cholesterol levels too if people have problems with cholesterol. And you would not need a statin then if you followed this and got your leptin levels down. Leptin levels do tend to be higher in people who have high triglycerides too.
Did you say your snack should be protein with that?
Protein with a carbohydrate, protein or fat with a carbohydrate. Sorry, I think that's what I said wrong.
How do you determine a person's type?
Is a blood test. Some people do a saliva test. They'll do like a cheek swab too. It's a genetic test that you can do, but you can do it by blood. You only have to do it once in your life. It never changes. So then you can tell what kind of system you have. Now with an APOE, each type is linked to different diseases. So like a 4 type, if you have a 4 gene, you have a higher risk of Alzheimer's disease and cardiovascular disease. If you're a 2-3, you have a higher risk of diabetes, cancer, and neurological things like Parkinson's. Some people don't want to know that information. They just want to know their blood type so they can have, or their genetic type so they can have their diet. But if you know that information, it's important to take some other steps to make sure that you prevent that. Very important for you to follow the right diet so you don't create a lot of inflammation and you can prevent a lot of those diseases. 3-3 is pretty neutral, so the only problem with that is high insulin and high leptin.
What test is that you're talking about?
It's called an APOE gene test.
Can a regular doctor?
Regular doctor can, family practice can order it. Yep, you can just ask for it, have them draw it with the regular lab.
Will they know how to interpret and be as knowledgeable as you?
No, probably not. They will know that if you have a 4 gene, you have a higher risk for cardiovascular disease and Alzheimer's disease, but they won't probably know how to interpret it and set up your diet. But there's a great nurse practitioner out of California. Her name is Pam McDonald. She created a whole book called The Gene Diet, and it explains all these genetic types and what to do and how to eat and how to exercise, because all of that's affected by your genetic type. So, not Not really. The lab we use charges, if it's cash, they charge $20 for it. So it's not a really horrible test. If you had it from Dynacare or LabCorp or something like that, they're probably going to charge you a couple $100 for that test.
So anybody can go to your lab, your clinic, or?
You can come to our clinic, but you'd have to see one of us to order the test. Legally, we have to see a person to order a test. Okay. So, anti-inflammatory diet, like we just talked about, key. There is a African mango called Ervingia, and that is what lowers leptin levels. That is the only thing that's been researched up until this point to lower leptin levels. We use this product from Life Extension. It's the only place that I know of that makes a really good quality leptin, and they worked with a manufacturer, gosh, it's been probably 8 years now, to develop this particular product and the strength and to use it the way it's supposed to be used. So it's Irvingia, Ervingia.
That's a type of mango?
It's an African mango. That's where it comes from. So this is usually used to lower leptin levels. If your insulin level is higher, then we have to use something else because it doesn't necessarily affect insulin levels, but it does drop leptin levels. I've used this in people and have had their leptin levels drop in half within about 3 months, which is pretty amazing. It's typically dosed with meals. So depending on which product, because Life Extension makes a couple of different versions of Ervingia, you could use either 1 tablet or 2 tablets, but it's always taken with your larger meals of the day. So if you primarily have 2 large meals a day, then that's when you'd want to take it. If you do 3 large meals a day, you could split it up if you need to. Do you want me to read that or spell it for you? You're good? Okay. All right. Myalept is a drug that's approved in the US by the FDA for people with low leptin levels, but I can say I've never seen anybody with a low leptin level yet. So I'm not sure who uses this. They do use it in people who have high triglycerides as a means to lower that, but I've not seen them. I've never seen anybody with a low leptin level, so I can't comment on how it would work for that. It's important to exercise 30 to 40 minutes a day. That will help lower leptin levels. I actually found a study that showed if all you did was exercise 10 minutes a day to get your heart rate up high enough, you could lower leptin levels by about 20 points in 3 months. So that's pretty good too. I think that for those people who are deficient in hormones, I think you should replace hormones since we now know that low estrogen and low testosterone can increase the leptin level. I think it's important for us to make those levels as balanced as we can get them so that we can optimize the leptin levels. The other thing that will help lower leptin is zinc, and you want to use about 30 to 50 milligrams a day.
There are lots of kinds of zinc.
There are lots of kinds of zinc.
So what word comes after the word zinc?
That would depend. Some people can only tolerate certain forms of zinc. And you'd kind of have to know a little bit more, like, do you have a detox issue? Do you have a sensitivity? Do you have a genetic predisposition to some things? But most people, they'll just try a basic zinc and see how they feel. The form so much isn't a problem with lowering the level. The form is going to be a bigger problem with how you process it or utilize it and a dose thing, and whether or not you're going to have side effects from it. That's more of an issue. That's a great question, though. Okay, so proper function, we're going to get rid of all your issues with leptin. Not really. You know, getting the leptin level down is not the end-all be-all to we're going to have perfect weight, we're going to feel wonderful. It does help with the weight, and it does help you feel better, but it's not going to be a quick fix, I will tell you that. Most of the time, a normal leptin level, let's talk about that. A normal leptin level is 20 or less. It's very common for me to see people with leptin levels 50 to 80, so quite high. People who are, I would say, moderately, I don't want to call them obese, but have a moderate fat level will have a leptin usually around 30 to 50, and you're looking at a good 3 to 6 months before that leptin level comes down. And that's if we can continue the diet on a regular basis. And we all know we're great with a diet for a while, and then you fall off the wagon. And then you got to get yourself back up on it again. So it kind of comes up and down and up and down. But it will make a huge difference for you. The key is the same key that we stress with everyone. Reduce stress, healthy eating, healthy exercise, balance. That whole piece is this whole process still. I also suspect that a lot of the genetic modification of foods are why we're starting to see a lot of these issues with leptin, why we're starting to see a lot of issues with weight that we've never seen before, why we're starting to see a lot of autoimmune diseases like we've never seen before. It's because our bodies haven't been created to eat these foods that have been genetically modified. So it's really important where you can to do organic as much as possible. God bless you. If you don't know about the Dirty Dozen, look up the Dirty Dozen, because if you're doing organic on a budget, get the Dirty Dozen. Follow that, do organics on that as best you can, and try to stay away from as much processed stuff as you can. I know it's really hard for us to go back to baking and cooking and doing everything from scratch, but that's really what we should be trying to do the best and the most of.
Is sleep?
Sleep is huge.
So, when you said 5 hours, like sleep is exempt of.
Sleep is huge. We're all sleep
8
deprived.
hours.
You need to be sleeping a good 7 to 8 hours a day. You want good deep REM sleep for at least half of that time. It's going to repair the adrenals. It's going to repair the immune system. It's very important. This sleep that we get from sleep aids, it's better than nothing, but it's not good sleep. It's not restored sleep typically. But you got to sleep. So for those people who've tried everything and they're still not sleeping and they have to do a sleep aid, well, it's better than nothing, but it's really not good organic sleep, but you need to sleep. It's important. Yeah.
Do you find this even with children? Higher leptin levels?
Yes, you'll find high leptin levels in children that have too much body fat. We are now seeing kids that are 8, 9 years old that have high cholesterol, and they're being treated with statin drugs, which is very scary to me because we've never tested those drugs in kids, and we don't really know what that's going to do. And this is probably going to be our first generation of children in a very long time who are not going to outlive us, because they're going to have a lot of diseases and they're going to die before their parents do. It's very sad. But yes, these kids can have high leptin levels as well. And especially kids who have a lot of hormonal dysfunction. Like, I don't know about you guys, but I remember growing up and there were not these young girls, none of us as young girls had all the muffin tops like you see now. Now maybe it's just the clothes that they're wearing, but we all wore hip huggers in the 60s and 70s, right? And you didn't see those muffin tops. Now these young girls all have the bellies hanging over. And that's from all the estrogen and excess hormones that are in our food sources that they're getting laden with at such a young age. And that's creating a lot of problems, and the McDonald's. I remember growing up, I thought it was a big deal if we went to George Webb's, and that happened like twice a year. And you'd go for, you thought you were great. But it wasn't every day or twice a week or any of that. We didn't eat that way, and we didn't have those kinds of foods available to us all the time. And soda was a luxury. It wasn't a necessity every day, Yes?
Is leptin related to MSG?
It's not related, but it can be raised by MSG. MSG is a not nice thing either. That's a pretty heavy duty toxin. A lot of people get migraines from MSG. It's a preservative, and they get a lot of migraines from that. Yeah.
How is leptin with the HCG diet?
Good question. So people who have a high leptin level, does everybody know about the HCG diet?
No, never heard.
Okay, so the HCG diet is a diet that we use using a hormone called HCG. It's the pregnancy hormone. And we put people on a pretty restrictive diet, anywhere between 500 and 900 calories a day. And the HCG starts to trigger the hypothalamus, because the thought process is that somewhere along the line the hypothalamus became damaged and you don't have a normal metabolic rate anymore, or set point, metabolism point. And so that the HCG then eats the body fat for fuel, and because you're not eating any fat in your diet during that time, you're going to scavenge and use your body fat. And the average weight loss is pretty good. It's about ½ pound to a pound a day. So it's pretty rapid weight loss a day. It's pretty rapid. After you're done with the HCG, and you can only do HCG for a maximum of 43 days in a row, you go on to a maintenance diet, which is very similar to what we've just talked about. And that's supposed to set your new set point or metabolic rate. And then it allows you to eat a normal 1,200, 1,400 calorie diet and not have all of that weight gain up and down, up and down, up and down. So when you're on the restricted part, your leptin level's definitely going to go down, but what we've seen when people are on HCG is because it's utilizing and mobilizing so much fat, if you tested someone's leptin while they were on HCG or shortly after, it's going to be pretty high because you're mobilizing all that fat. If you waited about 2 or 3 months after somebody was done with HCG, then you'd see more of a normalized leptin of where they're really at. But you wouldn't want to test it while they were doing HCG, or during maintenance I probably wouldn't either. I'd wait till after maintenance was done.
But that's kind of a good thing, though. I mean,
That's a good thing,
Okay.
because you're mobilizing that fat, you're getting it out of there, but you're going to probably see leptin levels a little high during that time. So we typically just don't do it when they're on that phase. We'll wait till afterwards, or we might test it before someone does HCG so we have an idea of where they're at before, and then some people like to test after and see what it did. Yeah. All right, and that is it.